What is Arneth count? Joseph Arneth, a German physiologist, classified neutrophils into 5 stages depending on the number of nuclear lobes present in the neutrophils. Arneth count assessed by peripheral blood smear examination like that of the TLC. We count the number of neutrophils with different number of the nuclear lobes, and it is represented in percentage. And this significance of this Arneth count is that it indicates the state of bone marrow activity or bone marrow functioning. And in this Arneth count, these neutrophils are classified into 5 stages, that is stage 1 up to stage 5. This stage 1, it is also called as N1, stage 2 N2, stage 3 N3, stage 4 N4, and in stage 5 there is N5 and N6. In stage 1, that is N1, the nucleus is unilobed and it is C-shaped nucleus, and their normal range is 2 to 5%. And these are the most young neutrophils. Then stage 2, that is N2, is nucleus is bilobed and the two lobes are connected by thin chromatin strand, and these are about 20 to 30%. Stage 3, that is N3, the nucleus is trilobed. There are 3 lobes in the nucleus and which are separated by thin strands, and they are about 40 to 50%. Stage 4, that is N4, nucleus is tetralobed. 4 lobes are present and which are separated by thin chromatin strands. These are about 10 to 15%. And stage 5, which consists of N5 and N6, the nucleus is pentalobe, that is there are 5 lobes which are separated by the thin chromatin strands and their number is less, that is 2 to 5%. N1 neutrophils, they are the Anger cells, and these N5 and N6, that is stage 5 neutrophils, they are the older cells and they are minimal in number, less effective and less motile. And N3 neutrophils, they are maximum in number and they are most effective and most motile. Then this Arneth count, we can say in this there is a left shift and right shift in Arneth count. Left shift means if the sum of N1, N2 and N3, this N1, if the sum of N1, N2 and N3, if it is more than 80%, this indicates the hyperactive bone marrow. It is also called as a regenerative shift. And here the new neutrophils are formed and released into the circulation. This is called as the left shift. Then right shift or degenerative shift means when N4, N5 and N6, N4, N5 and N6, it exists more than 20%. This indicates the hypoactive bone marrow. That is, there is reduced production and release of the new neutrophils. This is called as the right shift. Left shift is seen in pyogenic infections, tuberculosis, in case of hemorrhage or bleeding, and low dose irradiation. While right shift, it is seen in case of bone marrow depression, pernicious anemia, aplastic anemia, uremia, septicemia. In these cases, there is a right shift is seen. So that's all about Arneth count. Thank you.